I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Alaraki. May I know what brings you here today? Okay. Anything else? I'm very sorry to hear about it, Mrs. Alaraki, and I understand your worries that being parent, how a stressful situation would be for you. Can I check the reports of Fazal, Mrs. Alaraki? Thank you. Fazal, 1 year old, hemoglobin, ferritin, and serum are decreased, and TRBC is increased. And then I'll keep a report in front of me, and I'll hand over at the end of consultation. So, Mrs. Alaraki, is your son Fazal accompanying you today? Okay, Mrs. Alaraki, it would have been better if your child was accompanying with you, because I would have examined him and give you more appropriate advice. But it's okay. Please bring the child along with you next time if it makes sense to you. Okay. So Mrs. Alaraki, in order to reach my diagnosis, I need to ask you a few questions. Is it okay with you? Thanks for your cooperation, Mrs. Alaraki. So Mrs. Alaraki, was the birth of child normal? Okay. Full term, if your pregnancy was full term. Okay, and how about his weight? Okay. Mr. Alaraki, is all his immunizations are up to date? Okay. Is Fazal feeding properly? Okay. Do you think that he has achieved his milestones on time regarding his age? Smiling, sitting. Okay. If he's pale. Okay, Mr. Alaraki, have you noticed any delayed development? If he's irritable most of the time, most of the day. Okay, and how about his appetite? Have you noticed any poor growth? If he becomes short of breath while feeding? If he turns blue while feeding? Okay, Mr. Alaraki, I'll ask you for personal history of Fazal. Is it okay with you? Okay, so Mr. Alaraki, was a child breastfeed? Since for how long? 6 months. Okay. So if this is your first child. Okay, Mr. Alaraki, is there any financial difficulty? Okay, Mr. Alaraki, may I know what you do for a living? Okay, you're a great teacher. That's great, yeah. So, Mr. Alaraki, as you stated that you are a teacher, so who takes care of your child when you go for your job? Okay. Is child taking any medicine regularly? Mr. Alaraki, how about his bowel habits? If he has any loose stool or constipation? May I know the color of his stool, if it is black in color, or if there's any blood at the end of stool? Any history of trauma? Okay. If he had any blood transfusion? Okay. Okay. So, Mrs. Alaraki, what do you think is the cause of your child's symptoms? Okay, Mr. Alaraki, you need not to be worried. I'm here to explain everything to you, okay? And I'll be looking after, okay? So, Mr. Alaraki, as you have told me that your 1 year child Fazal is picker and has tummy pain and is getting paler and paler every day, and his appetite is decreased. Is there anything else you'd like to add? Okay. All right. So, Mrs. Alaraki, what I have gathered from information you have shared with me and investigation done, that your child is having a condition what we call in a medical terms is iron deficiency anemia. Okay. And your child's all symptoms are due to this problem. And do you know what is iron deficiency anemia? You need not to be worried. I'm here to explain to you. Actually, it's common in children. Okay. As a child exercise, so certain germs have entered in his body. Okay, and which has decreased the red cells of the blood. Okay, and so I will suggest a few lifestyle changes for Fazal. Okay, and so you have to carry. Okay, if it makes sense to you, Mrs. Alaraki, if you are with me, shall I proceed further? Okay, so Mrs. Alaraki, I'll strongly, encourage you to increase green vegetables and apple in the child's diet and egg. Okay, can you do this? Yeah, and besides that, Mrs. Alaraki, I'll encourage you, I'll advise you kindly take care of hygiene of Fazal, keep his hand clean as far as possible, and trim his nails. Okay, so that he does not eat paprika. Okay, can you do it? And yes, Mrs. Alaraki, as you said, as you are a teacher, so I'll advise you that you may arrange some person to keep the child under supervision while you are away, so that the child do not. If it makes sense to you. Okay. Okay, so Mrs. Alaraki, and now I'm prescribing you, a deworming syrup called mebendazole. Okay, as he is less than 2 years, so I cannot give him antihelminthics. Okay, so I'm offering a deworming syrup called mebendazole. Okay, I give him 1 teaspoonful once a day for 3 days only. Okay, but before mebendazole, I'm prescribing liquid paraffin. Okay, first give liquid paraffin 45 ml. Okay, instead. Okay, and then give deworming syrup mebendazole. Okay, and Mrs. Alaraki, this syrup is quite safe to use, but let me inform you that it can cause some loose motions, and your child or a child can become a little drowsy. Okay, so you need not to be worried. Okay, and I'm offering some iron supplements called ferrous sulfate. Okay, 1 teaspoonful. Okay, once a day for 3 months. Okay, after meal. Okay, and this syrup can cause black color stool. Okay, so you need not to be worried. Hopefully his deficiency will be subsided. Okay, fulfilled, and all parameters will become normal. Okay, and we'll repeat these tests in about 3 weeks time. Okay, if everything clear till now, should I summarize it again for you? Okay, so Mrs. Alaraki, I offer second follow-up visit after 1 month, then every 3 monthly for 1 year till HP is stable, then annually. Okay, if it makes sense to you. Yes, Mrs. Alaraki, and please bring Fazal with you when you visit next time. I would like to examine his tummy. Okay, so Mr. Alaraki, would you like to discuss anything else today? Okay, Mr. Alaraki, here is a leaflet. It includes all the information regarding his condition. I hope it will be helpful for you. Okay, I wish him, wish a child very speedy recovery. Okay, and a healthy life. Take good care of yourself and your son. And bye-bye.